Okay, I'd like to one more time open it up to the floor if there's any questions. Martin, right here up front.
I'm interested. I know you all are either internists or family practice, and I'm kind of interested in the specialty physician group that has to interface with the hospital and go to hospitals to do surgeries and labs and things like that, and how your EMRs may interface with that and how you get information back and forth, and whether or not partnering. I know you're with HCA, if they assisted you in the setup, and are you going to get the incentive, or does the hospital do that if they did help you with that?
Julie, can you answer that question?
I know who's going to get the money. Yeah.
I know we're not getting that.
Yeah, I don't think we're going to get the money. I mean, we may get a little bit of help with our bottom line, but that's a pretty easy answer, I think. But they've never really answered that straightforwardly. Maybe Paul can tell us too. But yeah, we had a lot of help. We actually worked through HCA, came in and did a really great job with implementation with us. We had a lot of support in setting it up, and that was all done through Nashville, where they come out of, and they had just a wonderful implementation team. Where we had some difficulties was with support afterwards. We were one of the first clinics up. There was a pilot project that tested out our product, and then we were one of the first major clinics up. So we were kind of a bit of a guinea pig. So they did a fabulous job with training and implementation, and then they kind of left. So that was tough, and so that was a learning. And then we've done really well since then. But the first few weeks after implementation were rough. But yeah, it was them that got us going.
So
to answer your question about interaction with the hospital, what happens with us right now is we have a fax server, and so the hospital will fax H&Ps, labs, x-ray reports, CT scan reports to our fax number. It's in the fax server. We have one individual scan those faxes that have come into the server and assigns them to the patient chart. Now, when I am at the hospital, I can get on the internet. We have a portal so that I can get directly into our virtual private network, and I can open up a patient's record, see their past history, their family history, their social history, and it makes me a lot more efficient when I'm doing a history and physical at the hospital.
And our hospital system is...
Yeah, I can do anything on my medical record through the internet and my virtual private network.
From the hospital?
I can do it from anywhere in the world, which is the bad problem. I mean, it's a good problem and a bad problem. I can go home and work. I can do it, you know, in leisure time with my dog there at my feet. But then again, if you're an obsessive compulsive individual, you may never ever quit working, because I can be there at home doing this stuff 24 hours a day.
Our hospital interface is set up much the same as what he described. So we have the same type of interface where things are faxed in and then scanned and attached to the patient's record. And we can do direct order entry, so anything that we would order through the hospital, such as diagnostic imaging, we can just order that directly through our EMR, and then it feeds right back in, and we get the results that way. And we also have the same problem of remote access, so we can get in and access it from anywhere too, which I agree is a double-edged sword.
But we also, anything that is scanned in has to be reviewed by a physician before it can be cleared.
I would like to know how many of those physicians up there are on a hosted model, and how many went licensed, and any technical issues, or if you're hosted on a web-based system, if you see a lot of delays between screen changing and so forth. If you're on a licensed system, if you've had any downtime with your own server.
I'm licensed. We've not had any downtime, thankfully.
In how many years?
6.
Yeah, we're licensed too, and we're still getting updates and stuff to our servers. There's been a couple times where things haven't worked quite right, but we aren't all using it, so, and there's still paper charts involved. So as of right now, I can't say that it's been a major problem, but who knows in the future.
We're licensed, and we have never had any major server issues, but when there was a power outage, we were out for about an hour and a half in 4 years.
We're also licensed, and we've been down for 4 hours maximum. We still had, thankfully, paper charts in the basement, and we went back to handwritten prescriptions for that time. We had a time over the last 3 weeks where we upgraded our softwares, and we have virtual servers now instead of the other kind, and I'm not real good at understanding all that, but when they did the e-prescribing part of that, there was some jinx in the software that had to be repaired, and there was a couple of days where everybody had to log off and kill the system for a few minutes to get it to reset. But that's happened, I think, once or twice in the last 3 weeks, and that system's run very smoothly since then. So
I don't know for sure what we're licensed or we're licensed anyway. Every once in a while, it's a nationwide server, and there have been a couple of times when the whole server went down, but man, they have it up in about 2 minutes. I have never seen, they just get it fixed right away.
Well, we are past our time, but we do have the room until 9 o'clock. If there's more questions, we'd be glad to take them. We have one in the back.
Can you speak to, some of you have mentioned that not all of the providers are on. Some of you did it slowly, some of you did it quickly. Can you speak to your thoughts and impressions on which is best? And if you had to do it all over again, would you do it differently?
Absolutely. If I had to do it all over again, we'd all go, I'd call it the Big Bang Theory. You do it all at once, all at the same time.
Absolutely.
I was ready to go from the day one of doing it and implementing it. A lot of my other partners were not. They wanted to ease into it, and I had told them if we do that, it's going to drag it out about 3 times as long, and it's actually been probably longer than that. If there was any other thing I could tell you about whether when you do it, make sure that the IT help you have, whether it's in-house or it's provided, make sure that you talk with those people, that you get along with those people and they know what they're doing, because I didn't feel like the IT help we got from our vendor was adequate enough, and we're struggling now because the training time is used up, but yet the system wasn't completely in place when we got our training. It was being implemented at that time. And so now we're kind of learning on the fly, so to speak. But if I had to do it all over again, we would do it all at once, all at the same time. Take the hit in production early on so that, 2 weeks, 3 weeks, a month from now, you're back up to running where you're supposed to be at, or where you were at before you had an EHR program.
We did ours all at one time. All offices, all physicians, and there's always a learning curve to these things. And the thing is, when you're forced to do it and can't have your little blankie next to you, you learn to use it a lot quicker.
we have the several offices, and I was glad that we were not the first office to go live, because a lot of the kinks were worked out. I think we were number 5 in the 7 or 8 that we did at the time. And so I was glad a lot of the kinks were worked out. Our IT people are our people, so they knew what they were doing, and it just went really smooth. And I would say I would never think about bringing one office up a little at a time. I think it would just be crazy, because you'll always have a few people that drag back, and if they never are pushed, and we had a couple hours we really had to just get behind them and shove, to get them to go forward, so.
Misery loves company.
Yes, that's,
Okay.
Someone, I think you mentioned patient portals, and I was just curious how many of the rest of you use a patient portal and for what uses and what percentage of your patients take advantage of them?
Did everybody hear that in the back? Question was about patient portals. How many of the physicians up here are using them and what they thought about that?
We're in process of setting one up, so I can't tell you how many are going to use it, but knowing our patients, I think they're going to be a lot.
We have a patient portal. One of our offices went live, I think, with that in October, and I'm not sure the percentage of use on that. Our office, we are starting to give out the PIN numbers right now, and we have several patients that are interested. They can be young and old alike. Sometimes you're surprised at who has, does want to do it. I have to have a little more training to understand how to use it, but they'll be able to pull their problem list, their allergies, their medicines, and they'll also be able to send us a brief message which will go through someone before it comes to the physician to kind of be screened and decide what to do with it. And then they'll also be able, I will be able to put their labs up, so with their PIN and their password that they sign, they will be able to pull the lab down, so I don't have to worry about sending it and making an error and sending it to somebody's wrong email or something, so I can't expose them from a privacy standpoint. They can get it, but I don't have to send it.
Okay. Well, that's about all the time we have for this evening. We'll have some, folks hanging around for private questions, but please complete your surveys because that really will drive the next programs that we do throughout the rest of this year and hopefully in continuum to help everybody out. But please take a moment to thank the physician panelists that were here and CMS.
Yeah.